Hello, and welcome to the presentation of the engagement findings towards an accessible Alberta report on engagement for potential accessibility legislation for the province of Alberta. Before getting into the findings that we'll be presenting today, we respectfully acknowledge that this project is taking place on the traditional and ancestral territory of many peoples, presently subject to treaties 4, 6, 7, 8, and 10. These include the Blackfoot Confederacy, Kainai, Piikani, Siksika, the Cree, Dene, Saulteaux, Nakota Sioux, Stoney Nakoda, and Tsuut'ina Nation, as well as the Métis people of Alberta. We acknowledge the many First Nations, Métis, and Inuit who have lived in and cared for these lands for generations. And we recognize the land as an act of reconciliation and gratitude to those whose territory we reside on or are visiting. During today's presentation, we'll be providing a purpose for the project, the approaches that were undertaken in conducting this engagement, learnings that were collected through the course of engagement, presenting the definition of accessibility that we have prepared for this project as an outcome, as well as the recommended principles for any potential legislation that may result. And finally, we will be concluding with the next steps that should or may take place following this work. With that, we'll come to introductions, and we'll first go over to the Office of the Advocate for Persons with Disabilities.
Hi, I'm Ryan Popplestone, Manager for the Office of the Advocate for Persons with Disabilities, also known as the OAPD. The Advocate and the OAPD are mandated to represent the rights, interests, and viewpoints of Albertans with disabilities. We do this a few different ways, including supporting Albertans to resolve individual concerns that they bring to the OAPD, education related to the OAPD and disability-related issues, and inform systemic change by advising the Government of Alberta on issues that would benefit from systemic change. Our work, in part, is to support inclusion, overcoming adversity, reaching one's full potential, and living fulfilling lives. Now over to Greg.
Hello, everyone. My name is Greg McMeekin. I'm the Advocate for Persons with Disabilities in Alberta.
Thank you, Ryan and Greg. My name is Mitchell Reardon. I'm a Senior Engagement Specialist at Happy Cities. Happy Cities is an urban planning, design, and engagement consultancy. We work on creating a more healthier, happier, and more inclusive communities in Alberta, Canada, and around the world. And I'm joined by my colleague, Cherry Hassami.
Hello, everyone. My name is Cherry Hassami, and I'm an engagement specialist on the Happy Cities team. I will pass.
Thank you so much, Happy Cities. My name is Marco Pasqua, and I'm an accessibility and universal design consultant with Meaningful Access Consulting, and we are a universal design and consulting firm specializing in everything from built environment accessibility to HR policies and review. And we were really excited to be part of this project because we are also two individuals with lived experience with both visible and invisible disabilities. And over to our colleagues at Thematic Consulting.
Thank you so much, Marco. My name is David Plamondon. I am the team guide for Thematic Consulting. We're an Indigenous-led consulting firm operating in Treaty 6 territory. Our core mandate is to create a better future for Indigenous people across all of Turtle Island through a decolonized approach for the consulting and community engagement work we do.
Okay, this is Ryan Popplestone again. I'd like to take a couple of minutes to introduce the project purpose. So in early 2022, the Office of the Advocate for Disabilities undertook research to understand the major issues impacting Albertans with disabilities. By July of 2022, we published our strategic plan identifying 5 core strategic priorities to help address those major issues. In that plan, strategic priority 3, to champion and mobilize stakeholder outreach work toward accessibility legislation, included work to research best practices in Canada related to developing and enacting accessibility legislation, and engaging and educating disability stakeholders on the breadth, impact, and value of accessibility legislation. We undertook 3 phases of work to help mobilize stakeholders. This included research, engagement, and reporting. Our research involved looking at what other Canadian jurisdictions have done about accessibility, as well as research on the potential economic impacts of accessibility legislation. The engagement of Albertans involved learning about their thoughts on what accessibility means to them, the current state of accessibility in Alberta, and informing what might go into the accessibility legislation. And finally, to produce a report for the Minister of Seniors and Community and Social Services to advise on the creation and implementation of accessibility legislation right here in Alberta.
Thanks, Ryan. This is Cherry Hassami speaking again. So now I'll take you through the project approach. Our project approach built on the extensive work undertaken by the OAPD. We conducted the following activities. First, we conducted a background document review. To strengthen our understanding of Alberta's existing accessibility landscape, we conducted a comprehensive background document review of current policy and research on accessibility in Alberta and Canada. In total, we reviewed 22 documents, including the Accessible Canada Act, OAPD Strategic Plan, Alberta Human Rights Act, the Why Inaccessible Alberta Act by Barrier Free Alberta, and numerous pieces of existing legislation, including the Persons with Developmental Disability Services Act, Assured Income for the Severely Handicapped Act, and Child, Youth, and Family Enhancement Act. Next, we did stakeholder, actor, and rights holder scoping. Starting with the OAPD's existing stakeholder lists, we conducted desk research, social media scans, and outreach to staff at key organizations to identify a diverse and representative cross-section of stakeholders. We applied an equity lens to the engagement process and all activities, taking steps to reach and include people from diverse age groups, racialized groups, and Indigenous communities, as well as those who face intersectional barriers to accessing healthcare services and participating in civic engagement processes. We also reached out to organizations that could be impacted by legislation and who have had an important role in serving people with disabilities, including business organizations, major tourism operators, transportation organizations, and urban planning and design professionals. We then conducted a visioning workshop with the OAPD. This digital session with key OAPD staff and members of the Accessibility Legislation Working Group helped to establish clarity on the project goals, identify key actors to engage, and refine the desired direction of the final report. We then began public-facing engagement, starting with communications and promotion. We used a variety of platforms and channels to inform the public and stakeholders about the project and build province-wide awareness. These included a digital project webpage and a press release highlighting key opportunities for the public to participate. Promotion included social media, including paid advertising that garnered 13,750 website visits and 51 posts in community Facebook groups. The OAPD also emailed 288 organizations, encouraging them to take the survey and circulate it with their communities. We also conducted print and digital news advertisements across Alberta with a focus on Edmonton, Red Deer, and Calgary. Next, to gather input from a range of people from across the province, we also developed an accessible, plain language, public-facing digital survey. The survey received a total of 223 responses over a 4-week period. To further tap into the knowledge, needs, and concerns of local stakeholders, our team designed and hosted 21 focus group sessions, with 16 taking place online and 5 in person. Participants included the general public, members of the disability community, advocacy and advisory organizations, and industry and sector representatives. Thematic Consulting also conducted engagement with Indigenous people within disability communities. Participants included a self-advocate, a community advocate, members of the Musqueam's Education Schools Commission, the Métis Nation of Alberta Health Director, and an influential First Nations elder.
Through the course of this engagement, we collected many learnings, which were organized around a series of service areas. And through the course of engagement, we sought to hear directly from many residents, the people who were impacted by this. A few of the quotes that were pulled from the sessions that we conducted that just are so helpful to underline, any accessibility legislation that is created in Alberta is going to improve the lives of Albertans. That is what this is about. It isn't about, new direction or rules or policy. It is about making the lives better for people who live in Alberta. A couple of the comments that we heard were, an accessible Alberta to me looks like one where those who need help do not have to jump through endless hoops and red tape to get the help they need. Everyone, no matter who they are, how they identify as, or what life circumstances they're living in, can participate in any events they would like to, participate in, and feel truly included. Learnings from this project were organized in the following ways: cross-cutting themes around the built environment, transportation, education and employment, healthcare, information, technology and communication, procurement, criminal justice, and Indigenous engagement findings. And we will be sharing findings from each of these with you right now. So first, Mitchell from Happy Cities, will share some of the cross-cutting themes that we heard. One of the issues that came up again and again and again was that finding, applying for, and navigating programs to support accessibility is a barrier. People had the perception and reported that it could be challenging to find out what kind of support was available, whether that was around education, healthcare, accessibility improvements to the built environment, transportation, and otherwise. And that once you did, applying for it could also be a challenge. And application barriers included, very distinct categories of disability. And if you didn't fit into that box, then you might not be covered by it. Complex processes, having to reapply, even if you have a permanent disability, and more. And navigating programs was also a challenge, which leads really well into the next one, which was the bureaucratic challenges to accessing services. In line with what I've noted previously, people found processes complex. Often when seeking help, you were passed from person to person to person, And broadly, there were perceptions that departments were more concerned with managing their fiscal responsibility than their responsibility to serve Albertans. These processes can be particularly challenging when you're taking the extra time to address these challenges while also trying to either live or care for someone, live with a disability or care for someone who has one, and left people feeling burned out and exhausted. People also noted that the definition of accessibility was not consistent, even among provincial governments or within the provincial government of Alberta, and when moving into the private sector or public and nonprofit realms. There was a critical emphasis on ensuring nothing about us without us. And that means that lived experience should play a fundamental role in shaping and administering programs. And recognizing that people with disabilities have diverse backgrounds and experiences, it's critical to not only look at this through a single lens, but consider the input, perspectives, and experience of a diversity of people with disabilities across the province. Participants in the engagement also emphasized that any provincial legislation that was to result from this must have teeth. It must be enforceable and incentivized. It could include penalties for not living up to the requirements of the legislation, as well as incentives to help encourage people and organizations to do so. And the need for greater awareness and information campaigns to help address stigma came up again. And in parallel with nothing about us without us, this includes greater representation in media, politics, and other decision-making realms. When it came to the built environment, it was highlighted that there was a major shortage of affordable housing, and then especially affordable housing that is also accessible. In many cases, housing that was deemed to be affordable or that fit within a program did not meet the accessibility needs of people who required it. Barriers in the built environment in Alberta were widespread. More than 50% of survey respondents reported that they had faced barriers in the built environment in the past year. It was also noted, or in line with this, that other than the building code, which provided base level accessibility that is inadequate, there are no accessibility standards for private buildings across the province. And even where standards do exist, there are loopholes that limit the effectiveness of them. And these include, a building requiring a floor plate of over 600 square meters in order to require accessibility standards, or older buildings being grandfathered in and not requiring renovation in order to become accessible. Participants also reported a need for minimum accessibility standards for parks, cultural, recreation, and sporting facilities. Many participants reported that before leaving their home or while planning an activity, they would check on information around accessibility. And if it was either limited or lacking, that would often be barrier enough not to participate or go to these spaces and enjoy the offerings there. People also underlined that physical disabilities were prioritized over invisible disabilities, and that there had been, some improvements around physical accessibility in recent years, but still very limited understanding and accommodation around invisible disabilities. When it came to transportation, people, particularly in the urban centers, noted that there needs to be more reliable access to transit stops in urban areas, that a lot of these stops cannot be accessed by people with disabilities, particularly those using mobility devices. And at the same time, that new transit infrastructure, such as the Green Line Southeast in Calgary, was demonstrating how this could be achieved. Participants in our sessions also noted that paratransit was not responsive enough for convenience, that the windows for pickup and drop off frequently did not allow for people to work, to use paratransit to access work, and that it was not a system that you could rely on. Ride-hail services were noted as often either lacking accessibility or the awareness around it. People noted refusals around pickup refusals when someone had a service dog, which is not permitted, and just a lack of vehicles that were accessible in the ride-hail fleets. Sidewalk accessibility was also an issue. This included sidewalk maintenance, snow clearing, and temporary changes at construction sites. And finally, there was a great need for affordable, accessible transportation in rural areas, where people reported in many cases there was an accessible transportation option, but it was cost prohibitive. And in doing so, meant that professionals did not have the option of living in some rural areas. And as a result, the competitive drive that they brought, the skills that they brought, were not applicable and not usable in rural areas. I'm now going to pass it over to Marco.
Thanks so much, Mitchell. Yeah, this is Marco speaking. So our learnings for education and employment were that there needs to be an increased accessibility standards in schools. Many children with disabilities who are homeschooled because the public school system isn't adequately designed to meet their needs. And many of our participants expressed that it should be easier for parents to access information on education resources and options. When it comes to private schools, they're not required to accommodate students with disabilities, leading to the perception that they're being systematically excluded and that these students are being excluded. Participants expressed a frustration that the accredited private schools receive government funding without being required to support students with disabilities. So with this, some proposed actions were that they provide a repository of information and resources for parents of children with disabilities, including the child's rights, to consider different streams of funding or a budget for schools to support children with varying levels of disabilities and needs, create schools specifically for the deaf and or blind in Alberta, require Braille and tactile signage in schools, provide resources to help teachers to adapt the curriculum for people with disabilities, and to investigate the use of the seclusion rooms. Now, when it comes to employment, it's kind of interesting because with regards to the stigma and stereotypings, a lot of individuals assume that individuals with disabilities don't want to work, when it's actually some of the systems in place and the hiring practices that are causing these barriers. Now, specifically, it was mentioned that there are clawbacks with regards to the AISH program. And the AISH program reduces income benefits if people earn above a certain threshold. This rule can actually disincentivize people with disabilities from actually seeking work, because they may not be able to keep the additional income, and this could risk them losing the AISH financial and medical benefits. So some proposed actions would be to reform AISH to remove the disincentives to work by ensuring that every dollar earned equals a dollar of increased income, that individuals do not automatically get excluded from receiving AISH if they, people who have AISH aren't automatically excluded from employment insurance. And lastly, to offer financial incentives and other supports to encourage employers to hire people with disabilities. Yeah, in healthcare, we learned that there is a lack of accessible standards for healthcare services and facilities. And several participants mentioned difficulties receiving care within their communities or nearest hospitals due to racial bias, suggesting increased sensitivity training may be required for medical professionals in Alberta. Support is especially important as more healthcare services require some virtual components, either related to paperwork or service delivery. And it's important to raise awareness among medical service providers that a large number of people with disabilities are not internet savvy. They also mentioned that there are long wait times and barriers for people with disabilities, and insurance programs do not adequately cover the costs for many of these services for individuals with disabilities. When it comes to information, technology, and communication, it was expressed that all government websites should meet the WCAG 2.1 level AA in the Web Content Accessibility Guidelines. There should be a rapid shift with the rapid shift to digital, that you must consider people without access to technology or traditional media formats. And that there needs to be a consistent labeling when it comes to the system of accessibility of destinations or temporary barriers. So when you are on websites, you can educate yourself as to what locations or transportations that you actually might need if you're going to a particular site throughout Alberta. And when it comes to emergency consistency plans must detail accessibility considerations. Participants reported that many venues, transit facilities, and businesses in Alberta do not account for accessibility in emergency situations. So our proposed actions would be to mandate that all provincially owned, operated, or funded venues and entities and facilities have publicly available contingency plans in case of that emergency. That we ensure that public facilities are equipped with emergency systems with multi-sensory alerts, including emergency communication options that meet a variety of needs. And lastly, that we ensure that provincial emergency management includes provisions for people with disabilities. When it comes to procurement, early design phase is the easiest way and most cost-effective way to make sure that a project is accessible. And that is really key, is to ensure that you're thinking about these things from the get-go. So some of the actions that we suggest in this process is that we have market readiness outreach so that people are aware of these processes, that there are strategies to raise awareness around the benefits of accessibility and the implications of the new legislation, that accessibility requirements in procurement policies are included for all products and services. And this is one of my favorites as an accessibility consultant. accessibility criteria in RFPs include compliance with accessibility standards and/or the provision of the support from accessibility consultants, particularly for capital projects. Because of the need of having to have that from the get-go and making sure that there is, again, that nothing about us without us approach. And lastly, direct input from the disability organizations and individuals with disabilities to ensure that the procurement practices are inclusive and meet their needs.
So it's David here. I'll jump in and talk a little bit about learnings around criminal justice. So people with disabilities are oftentimes overrepresented in the criminal justice system. This is particularly prevalent for neurodivergent or people who have disabilities around communication or access. There's also a significant amount of financial barriers. We've touched on financial challenges for people living with disabilities as well, and those barriers can be exacerbated when it comes to accessing adequate legal representation. There is a public system available, but those typically are overstressed, and so the access to reasonable legal representation when engaging with the criminal justice system can be particularly challenging for people with disabilities. As you might expect, when you examine the intersectionality of Indigenous people in Alberta with those who live with disabilities, there's a number of compounding barriers that those individuals face, particularly as it relates to racism and stereotypes. We've heard a lot from participants in terms of adequate access to healthcare, diagnoses for various neurodivergencies or other sorts of disabilities related to their access for learning and things of that nature, and then also how they interact with the healthcare system in general. One of the biggest challenges when we look at the examination or the intersectionality of Indigenous peoples with disabilities is the jurisdictional disputes that comes with access for treaty-based rights for Indigenous people. Treaty rights are typically seen as a federal issue, but then when the province is the one who's responsible for delivering many healthcare services, Indigenous people get caught up in this push and pull relationship where they're told that their healthcare access is a treaty right under federal jurisdiction, but their healthcare access is a provincial right. So it gets to a dispute where neither party's adequately servicing the communities that need this access, and leaving Indigenous people without proper access to the healthcare and supports that they need. Ultimately, what this leads to is a greater need for funding, allowing Indigenous organizations, Indigenous communities to access a consistent level of care, especially in remote communities that don't always have the same level of access to healthcare supports or other supports that can help them adapt to the disability challenges that they might be facing. Some quotes that we've had from some of the community members, specifically definition of accessibility. Accessibility means that we have access to all of the means that able-bodied people have in order to build ourselves a livelihood and a life that we deem appropriate for ourselves without interference. And relating to an accessible Alberta, being a place where the voices of disabled Albertans are sought and listened to. It is not a place where policies are made without the consultation of the disability community. It is not a place where the onus is entirely placed on disabled people to seek out and fight for access. It is a place that understands that barriers are created by societal attitudes and works to remove them. And those quotes are specific to Indigenous people living with disability, but there's a lot of parallels to a lot of the challenges that are faced by Indigenous people, particularly with the consultation, and really stresses the importance of the concept of nothing about us without us, both, especially as it relates to that intersectionality.
Hello again, Cherry here. So as David has been mentioning, and as you've been seeing and hearing, throughout the course of the project, hundreds of people across Alberta shared their experiences and perspectives on what accessibility means to them. Based on this input and definitions used in other jurisdictions from our research, we put together a proposed definition of accessibility. And so the proposed concise version is as follows. Accessibility is the meaningful, social, and physical inclusion of people of all ages and abilities who live in and visit Alberta. It means removing all barriers, social, built, attitudinal, or otherwise, to full societal participation and inclusion for people with an array of abilities and intersecting identities. An accessible Alberta ensures that people have access to the services they need in order to live, work, learn, travel, move through, and experience indoor and outdoor spaces, social events, technology, information, education, and healthcare with dignity, regardless of ability.
Thanks so much, Sherry. This is Marco Pasqua talking. Now we're going to go over some of our general recommended principles throughout this entire process. And we're really, really happy with this list that we've created of recommended principles to kind of drive forward the actions that we've created as a part of this proposed legislation. So our recommended principles are inclusivity, clarity and consistency, collaboration, compliance, continuous improvement, training and awareness, and decolonization. And I'm going to be covering the first two of those principles. So for inclusivity, the proposed accessibility legislation should ensure that all people in Alberta, including those with disabilities, have equal access to the built environment, transportation, education and employment, healthcare, information technology and communication, procurement, and the criminal justice in the province. For the purposes of clarity and consistency, the legislation should establish clear and consistent accessibility standards that not only the government must follow, but also make way for future inclusion of businesses and organizations, ensuring their products, services, and facilities are accessible to people with disabilities.
Collaboration is such an important aspect of this work. Continued collaboration and consultation with the disability community, including individuals with disability, organizations who represent those individuals, and groups that are advocating for the rights of individuals with disability, should be central to the development and implementation of accessibility legislation, both now and any future iterations of that legislation. As it relates to compliance, any proposed legislation should also include strong mechanisms to both monitor as well as enforce any compliance with accessibility standards to ensure that all government bodies, offices, private businesses, and public organizations are held accountable for providing accessible goods, services, and facilities for all Albertans.
This is Mitchell from Happy Cities. Continuous improvement means that the proposed accessibility legislation should be flexible and responsive to changing needs and advances in technology, and should aim for continuous improvement in accessibility standards in all service areas. When it comes to training and awareness programs should be implemented at all levels of government to help staff and those they serve to understand and comply with accessibility standards, and to promote a culture of inclusion and accessibility in the province. Decolonization is the last principle that we'll detail. And here it's the proposed accessibility legislation should be made with and in understanding with how settler colonialism has impacted Indigenous people with disabilities, and seeks to also address the colonial structures and systems that have caused these adverse effects. In addition, proposed accessibility legislation should be made with consideration of the Crown's obligations to First Nations under Treaties 6, 7, and 8. And so here we've covered the learnings and definition of accessibility crafted with this as directed in the Accessible Canada Act, and the principles that we recommend to guide this legislation. And you can access the full report through the OAPD With that, I'm going to pass it back to the OAPD for next steps in this important work.
Thank you, Mitchell. This is Advocate Greg McMeekin. As of the release of this digital presentation, a report on accessibility legislation in Alberta is being written by the Office of the Advocate for Persons with Disabilities. The report highlights the OAPD's research findings, what was learned, the engagement process, as well as recommendations regarding development and enactment of provincial legislation. The report will be submitted to the minister this summer, and we will look forward to additional opportunities to continue working with stakeholders and the government of Alberta toward enactment of a provincial accessibility legislation for the province.
Thank you all.